alignment, we make it different, where we actually have employed physicians and clinicians that are answering those phone calls that can see the data. We have it right there at our fingertips. So it's kind of like calling their doctor's office and getting a person to say, hey, okay, yeah, I can see the prescriptions you're taking. I can see your doctor, who that is, and your overall health history, what we have going here. So it provides a personalized member experience. So again, those are the kind of things that we're seeing. So, with data available and then combining that with this wanting and desire to change the whole healthcare system and make it better for our members. And then the one thing that this best quote that he had is he said, it's a privilege to serve those who have served us. Talking about our seniors, talking about our parents, our grandparents, it's a privilege to serve them and that entire age group, as well as those that are coming into Medicare early. So I love that because it really gives me fuel to know that this company is different. We're doing things for the right reason. These are some of the curves where, the 4.9 rating I mentioned on our survey calls and so forth, and it just continues to get better and better. So we'll jump into a couple slides here on our products, of course. And so to begin with, I want to talk about this slide. So a couple of sizzle points for you. So, when you go through product training, there's a lot to it, right? I wanted to have this as a little bit different to show you what do you need to know when you're talking and comparing. Somebody said, well, how does it work for this carrier? How does alignment compare? These are your top points that you'll want to remember is MRIs and CT scans. You're looking at a $0 copay for our plans. And then our CSNP Plus, which is a plan designed for those that have full access. Medicaid in Arizona is full access. That 20% goes to zero because they don't balance bill on folks that have full access. And, so even with that, it goes to zero. So when you look at these benefits and compare it to, what does an MRI cost? You get some other carriers, you'll see $225. You'll see lab copays of $15, x-ray is $25. You'll see all these different things come up. So just keep that in the back of your mind when you're looking and comparing benefits. So that's the first thing. Plus, if you look at some of the, my favorite benefit is one I'll share it, is the $200 grocery benefit on our CSNP Plus. That gives also $4,000 in dental on that plan. It's a great option for those that are full dual lookalikes. I mentioned the award-winning service and then our virtual care center. So this is a slide that's can't slide. So I have to say it's just because I wanted to make it easy, tangible at your fingertips. How are you making a difference? What is alignment about when you're looking and comparing benefits? The other thing I wanted to look at, our training team put this together. This is basically with January 1st. Now you're new in the Medicare space, so you're learning about these things. You have special election periods. January 1st, Medicare came out with the new election periods, FIDE and HIDE for those that are dual eligible. They have the fully integrated dual eligible election period, and then you have the highly integrated dual eligible election period. Well, with that, CMS did not eliminate choice for people. They still can choose what plan is best for them. And we as a carrier, we have our chronic special needs plan. So what the carriers are saying that have the dual integrated plans is they're saying they have to. But I'm here to say that that's not true. We still have the ability to put a dual eligible full access person into a Medicare Advantage plan, and our chronic special needs plan can work well. So just keep that in the back of your mind, especially when you're looking and comparing the benefits and what is really going to be the most appropriate plan for somebody. And then the second thing is okay, 2026, they have to enroll into an. So to begin with, it is CSNP season. We don't have an election period in the market for like a disaster. We're kind of all waiting, especially last week when it was 115. We're going to get a federal, FEMA disaster declared because that's the time of the year you have to have an election period to enroll somebody, right? You're turning 65, you're coming off a group plan, you've lost benefits somehow, you have, whatever case it is, you're looking for that special election because outside of AEP, October 15th through December 7th, you're always looking for a special election period to enroll somebody. But with our chronic special needs plans, the election period is a heart or diabetic condition. So that allows them once a year to enroll into a chronic special needs. Our plans are for those that have a heart condition or diabetic condition, And it's not pre-diabetes, because we get that question a lot, that their doctor's saying, well, you're pre-diabetic. Patients like, okay, I got pre-diabetes, I got to get onto a plan. It's like, no, they're not. They have to actually have, have a diagnosis of diabetes to be, qualified. So that'll allow you, now, even if they have a change. So you could have a member that they used that election period earlier in the year, because it's a once per, but maybe they had a change. Maybe they had an additional diagnosis, or they had some other change in their health history that puts them back into that shopping mode. And that's really what it's about. It's like, okay, well, you had a change. And so for your situation, you might have to, want to look in the market to see what else is available. And so that can be your election period that you can run. So our 003 plan is our superstar. We're selling a ton of this plan, a lot of good enrollments on this. And I don't want to go through every single line because it's going to bore you to tears, but I do want to point my favorite. So my favorite part of this plan is this flex benefit. So we have a $500 flex benefit on this, which allows a person to use, so maybe they have some additional dental services beyond the $2,000 that's already included. They can put the $500 towards that. Or maybe they have some podiatrist visits or something along those lines. They can, take that $500 even for things like grab bars. Maybe they have to get some improvements at home. There's some flexibility there in the way that benefit works.